Right, so let me just give you an update then on Birmingham. So the cases have gone down and the number of people taking tests has gone down as well. So it is looking really positive. This could be linked to the fact that there's a number of tests are being done at the moment in Frankly. So that could explain the increase in the number of tests. But we should know more in the upcoming weeks. In terms of the number of positive tests that are coming back, at 12.4% of PCR tests are coming back positive at the moment. So 12.4% doesn't seem that much. It's roughly one in 10, I guess you could say. So we still have lots more work to do. And the spread appears to be primarily occurring in households and social interactions that are happening. So in terms of the social interactions, we need to remind people to follow the national lockdown guidance. If you are with one person doing exercise, for example, make sure you keep your 2-meter distance at all times. In terms of household spread, I mean, this isn't always inevitable. And we will be sending out some information this week with some tips on how you can prevent spread in the household if somebody else is positive. The average daily COVID admissions in hospitals has fallen from about 150 a day to 125, which is also good. But pressure does remain high on the NHS. So we do need to keep that rate improving as well. So in terms of the South African variant, so we have reached out and spoken to the champions that live in Frankly or South Northfield, because during this time we really need their help in encouraging people to take tests locally. However, if you do know anyone that lives in that area, please do share with them the following links. So coming into the chat now is link 1, and that is the postcode checker to find out if they are in the postcode that requires them to take a test. The second link shows where in Frankly they can actually get a test, so they're really useful resources. Just in terms of house rules, I'm sure you all know them, so please go on mute whilst Dino is presenting. If we hear background noise, it can be a bit distracting for others. Secondly, there's lots to get through, so we won't necessarily have time to answer all the questions, especially those that are long or complex. So please keep questions quite short and concise if possible. And just a reminder that the only people that should be answering the questions in the chat should be Dr. Dino Motti or a member of the CCG. Right, I'll hand you over to Dino. Do you want to share your presentation?
Thank you. Yes, and welcome everybody. I'll share my screen. Just a second. Share screen. Okay, I'll put it full screen, so you should be able to see it. Can everybody see the screen?
Yeah, I can. Can everybody else?
Excellent.
Yep.
So
yes,
we've already done 2 sessions, and this is a recap. We've gone through the topic of testing. We discussed why we test, what is the rationale of testing, what we test for, which targets we're looking for with testing. We looked at different testing technologies, and we have looked at what facilities, where can we get tested in Birmingham for the different kinds of testing that are available. Then we've looked at immunity. We discussed what is immunity, how does immunity work, the different levels of immunity, different kinds of immunity, and we use this to bridge us into vaccines, to understand how do vaccines tap into the mechanisms of immunity to allow us to build up a response early, so that when we encounter a real infection with COVID, we are prepared and we don't get severe disease or worse. We have looked a little bit then at the vaccination theory. How do vaccines work? What kind of different vaccines exist? And ultimately, why do we vaccinate? What objective are we achieving with vaccination? Then we looked into specifically COVID vaccines. We looked at the different technologies that are available to vaccinate against COVID. We looked at the approval process, and we discussed effectiveness and safety. Today's topic is a little bit different. It is about another pandemic that's happening, that's in parallel with COVID, and it is a pandemic of misinformation, called infodemic, misinfodemic. There are a lot of marketing people that like to create new names for things, but fundamentally it is the uncontrolled spread of unverified information, which, thanks to the often beautiful thing that social media are, and internet, and and the new communication channels that we have, which allow us to get in touch without being in touch, they'll become a vehicle for the very rapid and very difficult to control spread of information, which is very often false or misleading. I think the next slide should be a quick video. It should be, yeah, it's a little graphic that shows that misinformation is incorrect or misleading information. We've seen some of this, but this information is deliberate misinformation. It's designed to deceive or mislead. So misinformation, as we said, can be an innocent mistake, but it is dangerous. Disinformation is targeted and it wants to pursue a certain agenda. This is just semantics, but exactly like a virus, information spreads, and our role, or the role of all of us, is to target one of these red nodes to make sure that we are not allowing that information to spread, exactly like a virus. We isolate ourselves and we block the chain of transmissions. And we do that by fundamentally asking questions, nothing fancy. We just ask the questions about the facts, the reality, and we challenge it. This is just because we're going full circle from the beginning. And I want this session to be a bit different than the previous one. So I will speak a bit, but I would like to also hear from you, your experience, and obviously answer questions. We have set up COVID Champions, and we all participate in it because this is exactly what COVID Champions do. COVID Champions are first receivers of accurate information and are embedded in the community, are members of the community with connections that can challenge to stop this spread. And as you notice, by just the action of a few, we have a major reduction in the spread of this information. It seems little, but it's fundamentally 4 people in this chain. And the result is a massive reduction in the reach of that false piece of information, or even accurately designed, misleading information for an agenda, which is misinformation. In order to navigate, this is a term that a lot of people like, but in order to handle the infodemic, the World Health Organization has created a few points that we should follow, and it applies to me, applies to everyone. I mean, it is something that is due diligence with any information we find. Even as public health professionals, we have to look at who has shared that information with you, with us. Where did they get it from themselves? Even if it is from somebody that we trust, friends or family, we need to vet and understand where that information comes from. It's very important. And also, as you notice, clickbaiting titles online are intentionally sensational and provocative. You have to go beyond. You have to check beyond the headlines, go read the content, and verify for yourself. Because the titles are built that way, the picture are built that way to capture and to be shared before you even read the content. Identifying the author is obviously very important. See whether they exist, whether they are real, whether they're credible. That is all part of the due diligence that needs to be done for all pieces of information, especially with COVID, but I would say in general. Checking the date. Sometimes things are completely out of date in the sense that it's something that, it's happened maybe years ago for something else, and it's being twisted. And this is a concept that we'll introduce later, which is malinformation, in the sense that it's information which is true, but is twisted and repackaged in a way that it produces harm and it becomes fundamentally wrong. One should also look at other supporting information, whether there are other ones of credible sources that support that piece of information, or whether they disagree. And that is part of the fact checking. Checking your biases is another very important thing. We always have to think, do I believe this because I am prone to believe it, or do I believe it because I've seen the facts and I can actually vouch for this piece of information? It is something that, again, we have to do. We all have some internal prejudice, internal want to believe something. We have to really check, because sometimes facts don't really align with our biases. And we have to turn to fact checkers as well. There are organizations, the WHO themselves do a very good job with this, but even the NHS and other organizations have trusted lists of the most common, let's say, information lines, and they do provide a rapid way to check whether that piece of information is accurate or not. And that is what with COVID champions we would like really everybody to do, because it's then in the community that sort of interaction happens, and it's more effective. And this is something that is very important, but it sounds simple, but it is actually crucial. So truthful information saves lives. So these days, knowing exactly how to test and how to isolate can save the lives of individuals, of family contacts. We've seen a lot of cases where misinformation, misunderstood information produced and supported the spread of the virus, or delayed certain actions which should have been taken, like just taking advice from a medical professional rather than taking the management of the virus into one's own hands, following unproven therapies or other information. Especially in the BME population, and I really urge everybody, I tried to link this video to PowerPoint, but unfortunately due to security technical barriers, the computers or the council don't allow you to put YouTube videos within a presentation on PowerPoint. But I really, everybody interested, I can share this link. Oops, I can share this link on the chat later. And it's a very informative video that highlights, I think, the real core of this is that the BME population, according to some statistics, some surveys that have been conducted in December, are much less likely to want, for example, to accept the vaccine compared with people of white background. But they're also, unfortunately, also much more likely to suffer the worst consequences from the infection. And this is down to a reduced trust in the government, the NHS, but also due to misinformation. And that is why it's of crucial importance to counteract the forces that would lead people to not trust or delay vaccination, because effectively then those are the people that will benefit the most from it. And truthful information, again, can save lives in this case. And as I said before, we need to know the difference between different kinds of, let's say, false information. This information, as we said, is false and intends to cause harm. It's something that is designed to mislead, to support false information in a proper voluntary way. There is misinformation, which is something that is false but is not created to harm. It's just somebody's not well informed and is just spreading around something that they didn't understand properly. And then there's malinformation, as we discussed before, is information which is based on reality, like a picture that portrays something that is, very clearly that, but it tells you that it's in a place, in a year, in a context that is completely different. And so repackages a piece of information to support another thesis, another line that doesn't really match. And so this is just to be aware of different categories, because as everyone, as COVID champions in particular, has to be engaged in identifying these. And this is, again, to highlight what we said before. We need to think before sharing. There's been, especially in the early stages of the pandemic, an infodemic on WhatsApp where messages were shared without thinking. It's very important that we just stop and think before clicking on something, before sharing it, before commenting it or endorsing it, because that's the way that behavior is reinforced, especially misinformation that influences that behavior. one element that I was myself very interested in learning is that a lot of this misinformation is designed or is successful because it produces a series of emotions which lead us to engage with that content and to share it. But that is the hallmark of the infodemic, is literally almost the way that the infodemic virus spreads by triggering a reaction which leads to an engagement with that piece of information, and it's sharing. It makes it viral, as in social media it's said. And it's very interesting, this analogy between the virus, which is a biological, physical entity, and what nation can behave like. They're very similar in a sense. But again, breaking the chain of contact is exactly like isolating, like testing, like following the infection control measures that public health and experts have advised in order to reduce the spread of the virus. The same happens with the infodemic. And in this case, we can also fight it by presenting the facts and the truth. That is probably the strongest way to counteract some of these. This is a meme that I always like. If it's on the internet, then it must be truth. This has been said apparently by Albert Einstein, who was the inventor of the light bulb, was born in 1996 and is still alive. And that formula there clearly gives it a lot of credibility. But in this case, if one finds in this book, for example, one should click that it's fake news. Obviously, we're talking about something that it's a bit funny in this case, but most of the memes that we see going around these days have a much more serious topic like COVID, and they spread information which is of much more serious consequence in terms of emotional response and behavior change. And they stoke fear, they stoke mistrust, and they induce people to make choices which are unhealthy, not safe, and induce then by chain reaction others to follow those sort of indications. Fake news, exactly like a virus, which is very simple compared to human cells or more complex organisms, does not need any proof, does not need ethical approval, it doesn't need long studies, no peer review, no scrutiny, no regulations. People who spread it have no scruples, no accountability. And in general, there's very little responsibility on social media, which is exactly the contrary of what we see when instead the regulators have to approve anything like a new medication or even these vaccines that have taken a long time to reach this stage and will be still studied for years to come. There are several in the pipeline still. And it's just the advantage of fake news, it's nimbleness, but the concerted work of COVID champions, of every ordinary member of the community and professionals, is that of highlighting their existence and counteracting them with facts. So, as I said before, it's very important to always, and this is what we should tell also others, not just individual behavior, but we should teach everyone, especially young people, children, I would say early, because social media now, it's something that is in the hand of every person with a phone. How does this piece of news make me feel? Why am I sharing this? How do you know if it's true? I should ask where it's coming from. And I should also ask whether there might be an agenda that I might unwittingly be supporting by sharing it, because there are, as we said, especially under malinformation and misinformation, potential secondary agendas that could have commercial, political, ideological reasons for spreading this information. And we don't want to be part of it, and we have to teach others that it's not just a matter of clicking, it's an effective endorsement sometimes to spread these pieces of information. We don't know who's going to receive it. We don't know how they're going to react. We don't know whether it's going to produce a seriously negative reaction immediately, or even change their behavior towards more dangerous choices, which could even cost their lives. So what are the best resources that we have in trying to control the infodemic? We have trusted sources like community and professionals. We have training and updates program like this one. We have access, thank you to the internet, which gives us social media, also gives us rapid, up-to-date access to verified information, which previously required a library or a journal access to some institution. These days, from the same keyboard from which we access Facebook, we can access very reliable, clear, succinct information from WHO, NHS, and PHE, CDC, a myriad of organizations which spend their time conducting research to show whether some or not. When we know that it's unlikely to be true, the scientific process is that of verifying it. And I think one of the best resources that we have, especially here in Birmingham, is the large number of COVID champions and growing, which participates to this seminar, to other seminars, participates to discussions in the community, and engages with all the members of our community that might have questions, they might need reassurance, or that might be unwittingly sometimes spreading misinformation and need to be challenged for avoiding that information to transform and join the infodemic. What is more trustworthy than social media? This is the question that I think we all have to ask ourselves. Right, we're not living in contact with each other because the pandemic forces us to move to remote communication like today, but we still have each other. And so I believe that what is more trustworthy than social media is effectively you. So it's COVID champions, it's informed citizens that very humbly and very responsibly fact check and relate their questions to experts if they can't find an answer, but make sure that every time there is an effort to verify information. So that's why I would like today to spend a bit of time hearing your experience, and if you have any questions, going through answers on specific topics, because I think with COVID champions, you can among each other also share best practices, experience, and make sure that you learn from each other. We need to have a little bit also of a community of practice that allows the best practices to emerge, and almost like, I wouldn't say classmates, but members of a team, you get to share your learnings. And I myself, I've not really been a COVID champion per se, can learn from this, and we can all learn from your experience. And I think this concludes this first part, and we can have a little bit of a discussion. If there is anybody with a question, I've pop up in my alerts here, but Holly may help me because I was more concentrating on the slides.
No, that's absolutely fine, and thank you, Dino. Your presentation went down an absolute storm. So many people would like a copy of it. Is that possible?
Well, I have as usually pinched a few pictures here and there, so I certainly can share it. Most of these are Creative Commons pictures, but I don't have the time to credit every single picture. So if I share it with you, it's only for private use, and do please not put it online, because obviously there might be some artists or some people with some copyright claims to the pictures, and I wouldn't like them to be sort of not be credited. But that said, yes, as a PDF, we have shared it in the past, and we can share it today.
That's great, thank you. We've had one question from Susan Whitmarsh. She says, "Hi, my 85-year-old mum is refusing the vaccination on the basis that she thinks it will interfere with her insulin and sugar levels. I wasn't aware this was a possibility. What should I tell her?" We've also got Rizwan on the call as well. If you want to answer the question as well, please feel free. But yeah, I guess diabetes in the vaccination was the first question. I
think Rizwan can answer. Certainly, I have never seen a reason why a vaccine should be withheld from a person taking insulin, and I don't believe there is a physiological correlation or mechanism, or there's any reason, medical reasons why the two would conflict. But Rizwan can confirm. I used to work in diabetes wards, but it's been a while, so I can ask Rizwan whether he has any more up to date, if anything has ever changed on this.
No, that's fine. Hi, Rizwan, can you hear us?
Yes, thank you very much. Hello. Hi. Yeah, so the short answer is no, it has no effect on the sugar levels. The long answer is that this is an inactivated part of a virus, which all it does is basically starts an immune response against it. So it hasn't really got an active part in it. It doesn't sort of interfere with the insulin hormone or anything like that. So it shouldn't really be a problem. In fact, I would probably say that those with diabetes, whether it's type 1 or type 2, are more at risk of the complications of COVID. So therefore, it would be even more important for them to have the vaccine.
That's great, thank you. I hope that helps, Susan. We've had another question, not so much about the vaccine, but just, I guess, misinformation in general. Oh, I've lost where I am in the chat. So someone says,
stop the sharing, probably change the.
Oh, it's okay, don't worry. Someone says, a small minority of people are deliberately spreading misinformation. I believe this is a criminal offence, ? Do you know if it is, Dino? Slightly off topic of the vaccine, I know.
I'm not a lawyer, and I have not really explored the legality of spreading misinformation, but I would not be surprised if there were elements of legal responsibility, especially when spreading misinformation. That said, we as public health professionals at this stage, we're not, we cannot wait for a legal proceeding to come to an end. We would like to engage before to make sure that that piece of information is not shared. And that's why I think all avenues should happen in parallel. So if there is any legal element that we can pursue, that will be to the lawyers or to Facebook or to regulators. As COVID champions, I think we should challenge that and report it to the social media system or whatever other channel is being used to spread it.
That's really helpful, thank you. And we actually haven't got that many questions today, so I might open it up to the floor if people perhaps have any examples of what they've done to combat dis or misinformation. I'm going to read out someone's comment here. So they said, I went...
Connection is frozen.
Oh, you're okay, Dino. So someone said, I went to do some shopping at the weekend, and they challenged somebody about wearing a mask in a polite fashion. They replied to me rudely with swear words. I was told by the shopkeeper that he also challenged people and sometimes calls the police about it, but they said that they can't do anything. So how can we re-educate these kind of, these people that aren't perhaps wearing masks? So I'm going to sort of reframe that, and I guess just ask anybody else that's on the call here, has anybody ever dealt with this sort of thing before? What have you done? Does anybody want to perhaps come off mute and come forward? Oh, we have silence.
Okay, I don't know. I've found myself a few times in these situations, and I think in general, the best approach, especially when in a public place, and just to avoid any confrontation, which might be potentially not even that safe, I would always politely indicate that, please, could you wear your mask, and indicate also that as it's possible that by not wearing their mask, they're putting others at risk, and there might be a person around here that is particularly vulnerable or lives with a vulnerable person. So highlighting their responsibility towards others, because a lot of people obviously might have a legitimate reason to not to wear a mask. There are very few exceptions, but we don't want to engage necessarily with that. And I've read recently of a mother who was not wearing a mask because her child was deaf and he was reading her lips, and there was a legitimate reason, I believe, not to wear a mask. But in general, there are some people that indeed don't wear a mask because they don't believe in their usefulness, and challenging them politely with facts is something that I think is more effective than aggressively facing them and transforming it into a confrontation, because it polarizes further.
Yeah, I agree with that, Dino. I've done a similar thing before. I just really politely said to somebody, oh, do you mind wearing a mask? We are meant to in these situations. And they said, oh yeah, I'm ever so sorry. And they put it on. And I guess the key thing is, if they do become aggressive or argumentative, as much as we'd love to change their mind, we might not be able to. And I guess the role of a champion isn't to enforce the guidance and the rules. But just if you can have that conversation, great. But if you can't, you know, from our point of view, you have done all you can. We've had a really good question here from Fiona. Does anybody have a good answer to people when they say that they don't believe that COVID exists? And she's totally right. Some people know that is their belief and that is their reality. So Dino, Rizwan, have you got any ideas?
But this is, I mean, unfortunately, denialism, so denying that something exists, especially when talking about the microscopic world, is not a new thing. It's been with us for centuries. I mean, we still have, unfortunately, people that deny that HIV exists. But the strongest response to those that deny that something exists is, unfortunately, the sad reality that we all know somebody who got the virus, and we all know somebody who of that virus had severe consequences, even died. So facing the denier with the reality of the consequences and the fact that that virus is at the moment really straining the NHS and transforming the lives of individuals, of communities, is I think the strongest way. So denying that fact is what usually makes it difficult. Then obviously for them to reply, but obviously, again, as a COVID champion, we don't want people to engage in altercations or in flames online. So if a person is particularly vocal or aggressive, we have to also try not to get dragged into a war of words. I don't know, maybe Rizwan knows more. He might have met somebody that supported those views.
Well, I do get that from time to time, and unfortunately, I think I've resigned to the fact that there are a few people who are going to be those that we can't convince, and I think we should stop wasting time on them and spend time on those people who we can convince and protect, essentially. I mean, the simple fact does remain that we have over 600 deaths a day. We have, a number of infections a day, and this is a lot more than just a common flu or cold, which we see every winter. We don't get the amount of deaths that we get in a given winter. We probably, the flu deaths are in the thousands, if not less. But this sort of 100,000 plus deaths is something which is quite unusual by all accounts. And I think we're doing a disservice to the memory of those who have passed away by belittling it, by saying that this doesn't exist. I mean, I know that some people have been going around hospitals looking at empty wards and saying, well, here, look, they're all lying. But those people have been redeployed to the front line, unfortunately, because they can't do hip operations and knee operations because the theaters are full of COVID patients being ventilated. So I think we do what we can, and hopefully we will convince some of them, but some of them we won't. And I think we have to be resigned to the fact.
Oh, sorry, Dino, you go.
No. I just wanted to add that, again, as Rizwan said, we may not be able to convince that person, but we may be able to make sure that they don't spread this misinformation. And so by making sure that we create, let's say, proper information instead that prevents others from being convinced of these sort of false truths, we really create a firewall around these people who deny in the face of the evidence that the virus even exists.
But on some good news, which I wanted to quickly share, as of the 4th of February, we have just done over 175,000 vaccines in Birmingham, and we've covered about 80.8% of our 80 plus with our first dose, and 90.9% of residents in all the care homes have been vaccinated. The rest haven't been vaccinated either because of an outbreak or have already got plans in place. So I think that is really a good piece of news that we can share, that those people who have been locked in essentially and almost forgotten about in care homes have now got their first dose. And I was fortunate enough to go and vaccinate in one of the care homes, and the sense of relief and the sense of freedom that they get, it's quite humbling that these people have been essentially been shielding for such a long time, and the end is in sight for them. So it's quite humbling to see that we are making a difference. And I think we shouldn't miss on the positive end of things. It's very easy to get bogged down with all the negativity. But the positive news is that we're making a lot of progress with vaccinations. And that really is the light at the end of the tunnel.
That's great. Thank you for that update. You might be able to help with this question as well. So Jane Clark she's actually asked two questions. The first one is, are there sufficient vaccine supplies for Brum to keep on schedule with vaccination targets?
So yes, there are sufficient supplies for vaccines in Brum, and I know that she has been working at the Millennium Point site and perhaps have been stood down. That probably may be because of the fact that we are now still mopping up the tier 1 to 4 in the priorities. And I'm very, very sure that you'll become a lot more busier when we start going down the tiers, particularly for the over 65s with chronic disease ailments, which we have targeted till May to get covered. I'm sure that's a much larger cohort, and you'll get much busier. And thank you for thinking about me and freeing up my time.
Thank you. We have a question that's actually moving away from the vaccine. From Deborah. I reported a business for being non-compliant, and the business member concerned went marching into my husband's business complaining who dobbed them in. They are now carrying on with blacked out windows. From a public health perspective, Deborah, you've absolutely done the right thing in essentially, anonymously whistleblowing. Obviously, you can do that again if you believe they're still not being compliant, but obviously it would be up to yourselves. As I know, a horrible situation to be put in. I really am sorry. Dino, do you have any comments about that?
Yes, I mean, the one can report businesses for not being compliant through the council website, and that is what we advise to do. It's the right thing to do. I mean, there is no other way about it. Obviously, if it's a business where one works, one has to be obviously also mindful of their own employment. That's why the council has put up a mechanism to do it without being sort of publicly individualized in the complaint. But yes.
And we've got a really good question here that we're actually asked quite a lot. A lot of people from the BAME community in particular are saying the vaccine affects fertility and are reluctant to take it. Can you please shed some light?
Yes.
Sure. Sorry, Dino, go ahead.
No, please, Rizwan. I very much appreciate it to answer this one.
Yeah. So I think that this is a common question, and it's been asked in the last one, and will be asked again, I'm sure, in the future meetings as well. There is no link with fertility and the vaccine itself. Like I explained, the vaccine is really just part of the spike protein, which is not an active component of the virus itself. It elicits no endocrine or any sort of response apart from an antibody production against it. So on the whole, physiologically, I cannot see how it would affect fertility. So it is entirely safe. We also give it in pregnancy, particularly if the person who is pregnant is in a high-risk occupation, like working in a care home, then it is even safe to give during pregnancy as well. And it is safe to give if you're breastfeeding as well. So no, there are no bases on which I would say that it affects fertility at all.
Absolutely.
Thank you. We've got a question from Hannah. Again, moving slightly away from the vaccine. Why are supermarkets preventing groups of shoppers? I went shopping yesterday and saw a family of 2 adults and 5 children shopping. This is in an area where there is an outbreak of the South African variant of COVID. Should we be challenging supermarkets? Now, I can probably take some of this question. So I know that Sandwell have publicly sent a letter And you can view it online to all the local supermarkets to say, please, can you do more? It should just be one adult really going into the shops at a time. And I know that Dr. Justin Varney is also doing some work on this. I don't know if you guys can add anything. It might be something that we have to take away and perhaps answer at a later date.
As the DPH has said, and as Sandro and others are saying, it is indeed responsibility of every individual to follow the rules, and supermarkets, I believe, should at the door remind shoppers that coming in and as a group is not ideal. So I think this is what's been done, and I agree that it's not a very responsible thing to do, coming as a bunch of people in the supermarket. And that's why social distancing and infection control guidelines are there.
Thank you. I just want to do a shout out to Alison Lilly, who I spent hours and hours last week on 3 Facebook pages using the information I had to help people from Franklin and Northfield get the proper up-to-date information and to help them with their fears. And I think it worked. That's absolutely fantastic. Thank you so much, Alison. Just looking through the other questions.
There's one from Mr. Ali here. If you want me to read that one out, Ali.
That's great. Thank you, Jack.
Okay. So he's talking about the South Africa variant here, obviously from Northfield himself, and he is referencing the recent reports that the AstraZeneca vaccine is less effective against that variant. I guess for one of you to comment on that.
Yeah, so I think it's a little bit complicated than a simple statement that the AstraZeneca vaccine is not effective. The AstraZeneca vaccine, according to the study found from South Africa today, is showing that it is not effective in preventing minor illness, but it is still fairly effective in preventing death and hospital admissions. So if ever there was a case of preventing complications and protecting the NHS, this would be it. And I think that strengthens the case of having the vaccine, whether it's AstraZeneca, Moderna, or Pfizer, for that matter. I think if you were to get away with a minor illness with COVID, then you're lucky. You're very, very lucky. And particularly with the South African variant, which is highly infective, I think, I would still advocate the use of the AstraZeneca vaccine rather, just to make sure that there is protection. Because after all, remember, we went into these vaccination programs to prevent death and hospital admissions, particularly in those vulnerable groups. So I think we would be doing a disservice to our population if we were to question the efficacy of the AstraZeneca virus in preventing those things. Yes, it may not be as robust in preventing minor ailments, but that's absolutely fine. I think that's something we can live with.
Thank you. We don't appear to have any more questions about the vaccine. Unless anyone else has got any they want to drop into the chat. We do have a comment from Deborah asking when the council website will be updated with the mobile testing units, locations and dates. And I've had a look and I can see what you mean, Deborah. So I will speak to the web team and make sure that goes live tomorrow so you can actually book a slot. I'm not sure where you're based in Birmingham, but there are a handful of the pharmacy sites that are open until 8. I don't expect you to go through all the pharmacy sites and find out, but I will try and send you an email with those just so you know for future reference. And I'll follow up as well what's going on with the website. Martin Laycock said, and we've sort of covered this already, but is there any info on the Pfizer vaccine, RE, the South African variant?
No, I don't think there is any information as yet. I believe that they're studying that at the moment. We are led to believe that there is still significant protection given by the Pfizer vaccine for the South African variant. Remember, the phase 2 and 3 trials were done in multinational centers. So South Africa, Brazil would have been covered, as would have been the UK. And I think, to be fair, there is a lot of information being mentioned about the South African variant, but we have to remember that the Kent variant is also mutating in a very similar fashion as well. So we have the threat of that as well as the South African variant as well. So we need to keep an eye on all variants of concern at the moment and see whether they're effective against vaccines. And I believe that is being studied as we speak.
Yeah.
Thank you. We don't appear to have. Oh, a question has just dropped in as I've said that. So Ross has said surge testing seems to be targeted at homes close to the identified cases. Are work and social contacts also being followed up? Are you able to answer this one?
I would not. I would be surprised if that were not the case, in the sense that it's the bread and butter of public health to identify case and do contact tracing, to follow all of the contacts and advise them on testing and isolation. So yes, I can confirm that.
So I was also on a call with Justin this morning with another group, and I believe that we are now targeting the Northfield area, particularly those people who work there, to get tested. Particularly for those who have got symptoms with PCR test and those who haven't with a lateral flow test. But particularly in that area of Northfield, we are asking for PCR swab tests, particularly if people are going to work. There is a small percentage of transmission of people who are working, picking up the virus. So yes, as part of the surge testing, this has been actively pursued.
Thank you. Does anybody have any final questions? If you would like to perhaps even come off mute and say them out loud, that's okay.
Absolutely.
It's very rare that we actually finish almost 10 minutes before. So yeah, if anyone does have anything to say, please feel free to come off mute.
It's Anita here. Could I just ask a question, please? A relative has tested positive for COVID and they self-isolated for 14 days. And then they tested positive again. And they are saying that they don't need to self-isolate because they've been told, yes, they can go shopping. And I said, I'm sure that's not correct. Can somebody clarify, please, the correct position?
Yes, absolutely. Rizwan, Dino, do you want to?
I think Rizwan can confirm what I'm saying, but at this stage, we don't have all the information to understand exactly why that advice was given. There are situations, though, where if a person is retested, especially with PCR, within a certain amount of time, they will still appear as positive. But if they are asymptomatic after the period that they've been isolating for, they're not infectious anymore. PCR is very, very sensitive and will find traces of the virus many weeks or months after the actual infection, and testing positive again without symptoms does not mean that that person is infectious or should continue isolating. But again, there are more pieces of information to this that we have at the moment, so I couldn't really confirm exactly whether that advice or why it was given was correct.
Yeah, I agree, Dino, that I think there's a difference between whether the test was PCR or lateral flow, and I think the advice is consistent with the PCR test because it's a lot more sensitive, and you'll find traces of the virus a few weeks down the line after an active sort of infection. The key thing is that after your period of isolation, if you are symptomatic, that means you still have symptoms, then you should carry on with the self-isolation. But if you're not symptomatic, then you're fine.
Thank you very much.
I think somebody else might have their hand up. Let me just have a quick look.
Holly, it's Mr. Ali here.
Oh, hiya, how are you?
Yeah, very good, thank you.
Good.
Not too bad. I want to take the opportunity to take advantage of the two esteemed speakers. We know that the BAME community have a low uptake of the vaccine, especially the people from a Black and a Asian stroke Muslim background. And in particular, then you got further cohorts. In particular, the women out of the Muslim community have even a more lower uptake, And I was thinking, you know, how can we encourage the women from a Muslim or a Pakistani background? How do we reach them and encourage them to go to their clinic and honor their appointment?
Okay, I think this is quite a complex question in the sense that there are multiple factors in play. And I was having this discussion with the mosques group this morning as to what we can do. I think the most effective way we can get through to those cohorts is by the GP picking up the phone and asking them, because they are trusted individuals within that community. And I know apart from vaccinating and looking after patients, there is a lot of demand on our time, but that is something that's essential that we have to do, because we are not going to get herd immunity and we're not going to get good coverage with the vaccine if a lot of people are saying no to the vaccine. So that's the first thing. The second thing that we're finding is that particularly in older generation, and particularly with the ladies of Pakistani origin, the healthcare needs are looked after by their younger population, so their children and their grandchildren. And unfortunately, if those people are not convinced about the vaccine, then the older people will be dissuaded from having the vaccine in the first place. So it's quite a bit of a complex picture, but the immediate way I can see of getting through is to have a sensible conversation with a trusted individual. And sometimes community leaders and faith leaders have got a part to play with it. COVID champions have got a part to play in this, and the GPs have a part to play in this as well. So the idea is convincing them with a trusted individual so that they can get the right information to make an informed choice.
I couldn't have put it better.
Thank you very much. Fiona, you've got your hand up as well.
Yes, thank you. I'd like to understand a little bit more about the rollout. So I want to know if you have to have finished rolling out to groups 1 to 4 before you can move on to group 5, and if there's going to be a delay while the last few numbers of groups 1 to 4 are picked up, or if you can just keep rolling it out according to how much vaccine you have available.
Okay, so the JCVI came up with a prioritization group because of the risk of death and serious illness in these particular groups. And I think what we found was that age was a major factor, followed by intercurrent illness and ethnic minorities, etc., etc. But what we found was the most important risk factor was age. Now, if as a vaccination site you have the vaccine, we would much rather have the vaccine in arms than in the fridge. So yes, whilst we would strive to give it to those within the priority groups, if we have run out of those patients, we will go down the priority groups as the vaccines would allow us to. So no, we're not sticking to one priority group, but on the whole, those people who are involved in the logistics of the vaccination are also keeping an eye. For instance, some localities in the East started their vaccination program a little bit later compared to some other parts of Birmingham. And that was because the number of people we had in the cohorts was less. And at that time, we only had the Pfizer vaccine. So you would get 195 vials with 5 doses each. And if you didn't have enough people in that cohort, those vaccines would go to waste. Therefore, it was slightly delayed for logistic reasons. And the vaccines are now being diverted to those areas for them to catch up as a priority compared to other areas who have had the vaccine for much longer and have picked up a lot more of their cohorts already. So it's a little bit of a complex play. It is to do with equity, but also to do with the priority groups on the whole. But it doesn't mean that if we have the vaccine, that we keep it in the fridge and we're not going to go down to further cohorts. Of course we are.
Thank you. So I think we'll just finish off with this question from Margaret, which I think I can answer. So what can we do about major news agencies misinforming the public? And the example that was given was a newspaper said that the vaccine was only 10% effective against the South African variant. So I guess one of the main things, I mean, we need to be realistic around what we can influence. But I think if you can get people to stand up to be a COVID champion, that would be amazing. I mean, you'll get information straight from the public health team in Birmingham. We'll give them updates that, you know, they're based on the facts as and when we get them. Do you have anything to add on that?
I don't think that a letter to the editor would be a bad idea. Obviously, depending on your time, but if you identify something that is misleading, I would say you can point it up to the editor of that newspaper, or even just challenge it within the COVID network to point out that is a potential source of misinformation that you have to know about when you speak with other members of the community, because that might be used as supporting sort of a non-true element of the narrative, and that is very important to even identify. So that is part of what COVID champions do, also identifying these elements spread by social media or regular media, which then may be misinterpreted or maybe ambiguous. So it is an important thing to know.
Thanks, Dino. If we haven't got any more questions, we can probably finish off there at 1 minute to 6. Thank you so much, Dr. Dino Motti and Rizwan, for your attendance really in this vaccination series. It's been really, really helpful. I hope you all have found it helpful as well. We will send out an email tomorrow just with the webinar link and the future webinar information as well. As always, if you need us, please do email us. And thank you very much. Have a lovely evening. Take care.
And I hope that you appreciated the more dialoguing style rather than going through the pack of slides, focusing on every single myth. That was the alternative that we didn't pursue.
And to be fair, I really just have 2 parting messages for the COVID champions here. And that is that I think the voice of reason and the voice of the accurate information needs to be louder than the voice of misinformation. And we need to carry on encouraging people not to share information that is not verified, because it takes 7 positive messages to recover from that 1 bit of misinformation. So I'm very, very grateful and very, very thankful for all the hard work which is being done in the background on social media by our COVID champions. And really, my hat's off to you. You've taken the time and you've taken the initiative to make sure that we spread the right information. And please carry on with this endeavor. Thank you very much.
Holly, if I may just have a brief word. Thank you, Councillor Peter Fowler, and certainly sit on the Health and Overview Scrutiny Committee. My thanks to Adina, because the last time I tried to get in, we had some massive problems, and you were all sitting in your meeting and I couldn't get in, but we're there. But I'm very grateful for the comments that have been made as well, particularly about the messages of getting through for people who don't believe the myths of this, that, and the other. And certainly the comments that have been made that I and others have made at the committee stage is about people from the ethnic minorities, communities. And yes, I would certainly agree that doctors are a good angle to help give the positiveness. But I think as well, as I was listening to Radio 4, the news time at 1 o'clock, and there was comments again about it needing imams and other faith group leaders, because I think even though with respect to GPs, even though that they are saying it's safe on this, that, and the other, there is that still error or message of doubt in the head. I think for certain, of course, with the thought of pork may being in because of obviously the faith, and they're uncertain, and it is the community faith leaders that, and they've all said themselves that we need to take this to our people and say, that it's safe. That then I think gives them the confidence to take the vaccine. But for many, many months now that we've talked about this at the committee, about the, and I do not like the word BAME, but the ethnic communities, how they seem to struggle because of various things that have been said to them, etc., that they shouldn't take it. But I'm so pleased now that slowly, bit by bit, that they are slowly coming round. And I think the messages, Dino, and others that are being sent when we get the Tuesday update, I myself on the Harborne Community Facebook, where I'm a city councillor, I put on messages there about myths, etc. And I think it's slowly coming round. So I look forward in the months to come for an even bigger decrease with the sad deaths that we've gone through. And I am still amazed why people actually are out there saying that it doesn't exist. Tell that to the loved ones that have lost family members over this past year. Tell those that have gone through the misery of all this, and ask yourselves why you're in disbelief that this is not happening. It's real. And finally, my wife tells me when she's gone shopping that yes, that she said to me she'd been into Asda and there've been people on the front door saying you can't come in if you haven't got a mask. They give masks, but the store people have actually said that they've been round, and surprisingly, there's people that then put it under their chin or under their noses, and people have had to come along and say, either A, can you self-distance, and as well, can you please put your mask back on, because you are protecting yourself as well as others. It's just going to be one of those things that's going to slowly, some will never, as the doctor has said, they'll never understand, but as the GP has said, that Rizwan said, you just got to leave it to them, and hopefully they come round. But thank you for the time to make a few comments there.
Thank you, Councillor. And I think what I would probably end on a more jovial note to say that treat your mask like your underpants. If they get wet or dirty, change them, and don't wear them below where they're supposed to cover your bits.
That's fantastic.